Hi, once again, this is Carl Hansen, Dr. Hansen. Another DPC short on insurances. We don't participate as direct primary care physicians in insurance, although most of our patients have insurance to cover big ticket or catastrophic items. It doesn't always work out well anyway. Just to let you know that besides insurances, there are such things as health shares, but we're going to cover insurances. There's the misconception that insurance companies are there to fight for you to reduce the cost of health care and healthcare charges. They don't. And what I'm going to first do is we're going to go right to the math. We're going right to the calculations here. So again, this will be less than 10 minutes in total duration, and this will be even shorter time than that. So we're going to talk a little bit about insurance premiums. An insurance premium is something that you're going to have. There's a rule about when an insurance company gets a premium, when you pay them a premium. There is something called the 80-20 rule, or something called the medical loss ratio. Don't worry about the name right now. But in essence, it says, among other things, that insurances must spend 80% of whatever premium is that they collect from all the people and all the employers. 80% of that, what they collect through premiums, has to be spent for medical costs, medical expenses, and that the insurance companies then therefore get to keep the balance, the 20%. And they keep that, and that goes towards their overhead, their profits, etc. And here's an example. So under our current day of high healthcare costs, let's say an insurance company brings in $1 million in premium. All right. So let's say they have to abide by the 80% rule. Well, that means of this $1 million they bring in, that they have to spend $800,000 in medical expenses. They have to actually pay for people's hospital stays, MRIs, etc. Now, if the $800,000 taken from $1 million leaves the insurance company with $200,000 to play with to cover overhead, etc. That is, in fact, the 80-20 rule. In some instances, it's 85-15, but it's the 80-20 rule. Again, insurers must spend 80% of the incoming premiums for medical costs, just like this example gives. So let's go a little bit further. Let's say that instead of high costs of healthcare, that healthcare costs were actually lower, that hospitals were cheaper, that MRIs were cheaper, etc., that surgical procedures were cheaper within a hospital. So let's say they still collect the $1 million premium, because that's all the money we send into them. But instead of $800,000 in medical expenses, let's say medical costs, the surgeries, the hospital stays, actually only come in at $500,000 because the costs are less, but the hospital charges are less. So there's already a violation here of 50%. So they're collecting $1 million in premium. They are only spending $500,000. So they are actually, medical expense is 50%, which I have a red X saying you can't do that. And so if medical costs go down, rather, if medical charges go down, then the proportion spent on medical costs drops below the 80% threshold. This is the example. Medical costs went down. They still collected $1 million in premium, but the medical costs went down, so they spent 50% of all their premium on medical expenses. Well, that's a violation. If an insurance company collects premiums and they only spend half of it out there, that's a violation of the 80-20 rule. Let's take the next step. Now, to bring things back in compliance, again, let's take the $500,000 in expenses, and now we're going to make sure that they follow the 80% rule. All right, so we're going to recalculate. So the consequence of a lower medical costs out there, cheaper hospital stays, etc., but having to comply with the 80% rule, in this example, we'll find that the need to comply with the 80% rule means that the premium would be $625,000. So all we did was do a reverse calculation, that if they spent $500,000 and that $500,000 had to be 80% of something of the premium, that calculates that the premium really should be $625,000 that they brought in order that a $500,000 expense therefore creates 80% of the premium. So the premiums must be reduced for the $500,000 cost to end up being 80% of the premium dollar. What does lower premiums mean? If they reduce the premiums they collect, that means you pay less for insurance. Your premium you pay every month, or your employer pays, is actually less. Well, let's take that a step further. So if their premiums are $625,000 because they had to do that to comply with the 80% rule, that means the other 20% they keep is $125,000. So 20% of the 625 is $125,000. So of the $625,000 in premium they collect, they keep $125,000. So that's what happens when we recalculate this, that based on the premium amount, that they keep $125,000. So look at this difference here. With the higher cost of healthcare, with higher charges, their premium, they get to keep $200,000 for themselves to do with what they want. If healthcare costs are lower and therefore premiums are lower, they only get to keep $125,000 in order to maintain the 80-20 rule compliance. So the conclusion is lower healthcare costs, lower hospital charges, surgeries, etc., reduce the amount of money the insurance companies can keep. Insurers need the big pie. They need the pie really big, that is the premium intake, so that their fractional share also stays big. Remember, when the premium was $1 million to stay in compliance with the 80 rule, they got to keep $200,000. Lower charges means lower premium. Lower costs means lower premium. So the 80% rule means they keep $125,000. So the moral to the story, it is not in the insurance company's business model to have lower healthcare costs. Because if there are lower healthcare costs out there, then the premiums have to go down. And their 20% of that premium is therefore mathematically going to be significantly less. There's a quick and easy method to figure out under the current Affordable Care Act, Obamacare law. The 80-20 rule benefits the insurance. It benefits them if they can somehow artificially keep healthcare costs high. Now, you see, they certainly wouldn't do that. Why would they do that? Well, let's take a look at this. So here is an excerpt from Open Stats, and this shows for Cigna, one insurance company, that their lobbying efforts over the past couple decades have gone up considerably. And since 2010, with Obamacare, their lobbying numbers have gone way up. They now are able to get spending. They're spending $9 million. This one insurance company is spending $9 million lobbying your Congress, your senators, your representatives, and also the non-elected individuals who run Health and Human Services, etc. Here is a telltale graph. Dr. Wallen, a JJW Urology Twitter handle, has this excellent graph that shows where we are, that United Healthcare stock prices have gone up 1,600%, their share price. Remember what I said, insurance companies, their main motivation is to not improve a patient's health. Their motivation is to increase shareholder value and price. That's what they're about. They're a publicly traded company. You can't just stay static, you have to grow. Family deductibles here, those have gone up over 110%. Premiums, the amount that families pay to these insurance companies, to the Blue Crosses, United, Cignas, Aetna, Humana, those have gone up 61%, whereas wages and inflation have just gone up a little bit. So insurance premiums are based on artificially and made up healthcare charges and costs, and they're stealing money from us. They're stealing money from employees. Employers can't give raises as readily because the employees because so much of the healthcare costs are being shared by the employers. So there's a lot of moving parts to this. I have an individual story also. Besides the cost relative to money, the insurance companies make the physicians jump through hoops. And I'm not contracted with any insurance company, so I get to avoid a lot of their junk. But I still have to do prior authorizations. And I had a lady who's been on a diabetic injection, Victoza, for 10 years now. Same dosage, doing great on it. This year I got this notice from Optum that I had to do a prior authorization. Now Optum knows exactly that this lady has diabetes, and they have her data. They know she takes Victoza on a very stable, static dose for 10 years. And all of a sudden they're coming out of nowhere and saying, I need to do some special hoops to jump through to get something okayed and authorized. Again, a lady who's stable, a lady who's prescribed a drug by a board certified practicing physician for 35 years. I get the bean counters, get to question my judgment on this. A lot of people ask, so why are you have this thing about the insurance companies? Well, this is part of the reason. They are part of the medical industrial complex, which is screwing everything up, and they are a major part of it. So what we can do to avoid them, to decouple from them, the quicker we can do that, the better, both physicians and patients. We all need insurance, right, of some type to cover for catastrophic stuff. Understand that a lot of people, even with insurance, most people that get bankrupt from medical expenses actually have insurance of some type, but they just can't cover some of the deductibles and some of the inflated charges. So thank you again for listening. Hope that gives you a little bit. Hope that we did that in 10 minutes or less. And thank you once again for listening, and we'll catch up with you next time. Bye.